Welcome to today's video about symptoms of high blood pressure. Did you know that over 1.28 billion people worldwide are living with high blood pressure, and nearly half of them don't even know it? This silent killer often creeps up without warning, but your body is always giving you signals. Are you ignoring them? But here's the good news. Catching these signs early can save your life. So, how do you know if your body is waving a red flag? Which symptoms are easy to miss, and which ones could mean it's time to act fast? Stay with me, because in this video, we'll break down the real signs your body gives you, backed by science. And don't miss the most overlooked symptom at the end. It's the one doctors say you must know. Ready? Let's dive in. And don't forget to hit like and subscribe for more life-saving health tips. Please note, this video is for informational purposes only and is not a replacement for professional medical advice, diagnosis, or treatment. Always consult a healthcare provider for any medical concerns. All research information shared here has been verified by researchers. You can find all references to the studies mentioned in the description below. All right, here are the warning signs you need to watch for. Let's begin with the first one. Headaches. Experiencing a throbbing headache? It might be more than just stress. High blood pressure, or hypertension, can sometimes manifest as severe headaches, especially when blood pressure spikes suddenly. When blood pressure rises rapidly, it can increase pressure inside the skull, leading to intense headaches. This happens because the elevated pressure forces fluid into the brain tissue, causing swelling and pain. Such headaches often come with other symptoms like confusion, vision changes, or nausea. A study published in the Journal of Headache and Pain in 2024 highlighted this connection. Researchers found that individuals with high diastolic blood pressure had a slightly higher risk of experiencing migraines. This suggests that managing blood pressure could be key in reducing certain types of headaches. It's important to note that not everyone with high blood pressure will experience headaches. However, if you frequently have severe headaches, it's wise to monitor your blood pressure and consult with a healthcare professional. Early detection and management of hypertension can prevent more serious complications down the road. Remember, your health is in your hands. Regular checkups and being attentive to your body's signals can make a significant difference. Next, number 2. Dizziness or lightheadedness. Experiencing dizziness or lightheadedness can be unsettling, and it's important to understand how high blood pressure might play a role. When blood pressure rises significantly, it can damage and narrow the blood vessels, reducing blood flow to vital organs, including the brain. This diminished cerebral circulation can lead to feelings of unsteadiness or faintness. A study published in the Journal of the American Heart Association in 2020 highlighted that orthostatic hypertension, a condition where blood pressure increases upon standing, is linked to dizziness. Researchers found that this blood pressure spike can disrupt the body's normal response to posture changes, leading to reduced blood flow to the brain and subsequent lightheadedness. It's also worth noting that certain blood pressure medications might cause dizziness as a side effect, especially if they lower blood pressure too quickly. If you're experiencing persistent dizziness, it's essential to consult with a healthcare professional to determine the underlying cause and appropriate treatment. Next, number 3. Blurred or double vision. When blood pressure remains elevated over time, it can damage the delicate blood vessels in your eyes, leading to vision problems. This condition, known as hypertensive retinopathy, occurs because high blood pressure causes the retinal arteries to narrow and harden, reducing blood flow to the retina, the part of your eye responsible for capturing visual information. As a result, you might experience blurred or double vision. In severe cases, high blood pressure can lead to swelling of the optic nerve, a condition called optic neuropathy. This swelling disrupts the transmission of visual signals from your eyes to your brain, further contributing to vision disturbances. The American Heart Association highlights that blocked blood flow from hypertension can damage the optic nerve, potentially causing vision loss. A study published in the Journal of Human Hypertension in 2023 examined the impact of chronic hypertension on retinal health. Researchers found that prolonged high blood pressure leads to significant changes in retinal blood vessels, such as arteriolar narrowing and arteriovenous nicking. These alterations were strongly associated with an increased risk of vision problems, including blurred and double vision. The study emphasizes the importance of regular blood pressure monitoring and management to prevent such ocular complications. It's crucial to manage your blood pressure through lifestyle changes and, if necessary, medication. Regular eye examinations can also help detect early signs of hypertensive retinopathy, allowing for timely intervention to protect your vision. Next, number 4. Shortness of breath. When your blood pressure is consistently high, it forces your heart to work harder to pump blood. Over time, this extra effort can lead to the thickening of the heart's left ventricle, a condition known as left ventricular hypertrophy. This thickened muscle can become stiff, reducing its ability to pump blood efficiently, which may cause fluid to accumulate in the lungs, a condition called pulmonary edema. This fluid buildup makes breathing difficult, leading to shortness of breath. In severe cases, extremely high blood pressure can cause a sudden increase in pressure in the pulmonary capillaries, leading to acute pulmonary edema. This rapid fluid accumulation in the lungs results in a sudden onset of breathlessness and requires immediate medical attention. A study published in the Journal of the American Heart Association in 2023 highlighted that pulmonary edema was the second most common condition associated with hypertensive crises, following ischemic stroke. This finding underscores the critical link between elevated blood pressure and respiratory symptoms. It's essential to monitor your blood pressure regularly and consult with healthcare professionals if you experience persistent shortness of breath, as it could be a sign of underlying heart issues related to hypertension. Next, number 5. Chest pain or discomfort. Experiencing chest pain can be alarming, and it's important to understand how high blood pressure might be a contributing factor. When blood pressure is consistently elevated, it forces the heart to work harder to pump blood. This increased workload can lead to the thickening of the heart muscle, particularly the left ventricle, a condition known as left ventricular hypertrophy. As the heart muscle thickens, it requires more oxygen. If the oxygen supply doesn't meet this heightened demand, it can result in chest pain, commonly referred to as angina. Moreover, high blood pressure can cause damage to the inner lining of arteries, leading to atherosclerosis, a buildup of plaque that narrows and stiffens the arteries. This narrowing restricts blood flow to the heart muscle, further contributing to chest discomfort or pain. Interestingly, a study published in the Pain Reports in 2019 found that individuals with lower systolic blood pressure reported higher chest pain scores during acute myocardial infarction compared to those with higher systolic readings. This suggests that blood pressure levels can influence the perception and intensity of chest pain. It's also worth noting that high blood pressure doesn't always present noticeable symptoms. Regular monitoring and management are crucial to prevent complications like chest pain and more severe cardiovascular events. If you're experiencing persistent or severe chest discomfort, it's essential to seek medical attention promptly. Next, number 6. Nosebleeds. While high blood pressure isn't typically the direct cause of nosebleeds, there's an interesting connection between the two. Research indicates that individuals with hypertension may experience more frequent or severe nosebleeds. For instance, a 2020 study published in JAMA Otolaryngology, Head and Neck Surgery, found that patients with high blood pressure had an increased risk of nosebleeds requiring hospital visits. The delicate blood vessels inside our nose can be more susceptible to rupture when subjected to the increased pressure from hypertension. This doesn't mean that high blood pressure directly causes nosebleeds, but it can make the nasal vessels more prone to bleeding. Moreover, if a nosebleed occurs, elevated blood pressure might make it more challenging to control the bleeding. It's essential to understand that while there's a link, not everyone with high blood pressure will experience nosebleeds, and not all nosebleeds are due to high blood pressure. However, if you're dealing with frequent or severe nosebleeds, it might be worth discussing your blood pressure with a healthcare professional. Next, number 7. Fatigue or confusion. Experiencing fatigue or confusion. These could be signs of high blood pressure, even if you feel fine otherwise. High blood pressure can damage your heart and kidneys, leading to tiredness. When your heart struggles to pump blood efficiently, your body doesn't get the oxygen it needs, making you feel worn out. Kidney issues from high blood pressure can also cause fatigue. According to Healthline, fatigue can be a symptom of heart or kidney damage resulting from high blood pressure. Confusion is another concern. Severely high blood pressure can lead to hypertensive encephalopathy, a condition where the brain swells due to sudden, extreme blood pressure spikes. This swelling can cause confusion, headaches, and even seizures. The Cleveland Clinic notes that hypertensive encephalopathy is a medical emergency and can be life-threatening, with common symptoms including headache, restlessness, confusion, and seizures. Recent research highlights the connection between high blood pressure and cognitive decline. A study published in Hypertension, 2024, found that hypertension contributes to cognitive decline through vascular damage and inflammation, leading to brain atrophy. It's essential to monitor your blood pressure regularly. If you're feeling unusually tired or confused, don't ignore it. Consult a healthcare professional to check your blood pressure and discuss any symptoms. Early detection and management can make a significant difference in your health. Next, number 8. Nausea or vomiting. When blood pressure soars to dangerously high levels, it can lead to hypertensive encephalopathy, a condition where the brain struggles to cope with the elevated pressure. This situation often results in symptoms like nausea and vomiting. The brain's area postrema, which detects toxins and triggers vomiting, becomes activated due to the excessive pressure, leading to these distressing sensations. A study published in the Journal of Clinical Medicine in 2023 highlighted that individuals experiencing a hypertensive crisis reported nausea or vomiting. This significant finding underscores the importance of recognizing these symptoms as potential indicators of severe blood pressure elevations. It's crucial to understand that while nausea and vomiting can stem from various causes, their presence alongside other signs like severe headache, confusion, or vision changes should prompt immediate medical attention. Timely intervention can prevent further complications associated with uncontrolled hypertension. Next, number 9. Heart palpitations. Elevated blood pressure can sometimes lead to sensations of a racing or fluttering heartbeat, known as heart palpitations. This occurs because high blood pressure can cause changes in the heart structure and function, such as left ventricular hypertrophy, which may disrupt the heart's normal electrical signals and lead to irregular heartbeats. A study published in the Journal of the American Heart Association in 2020 found that intensive blood pressure control significantly reduced the incidence of atrial fibrillation, a common type of arrhythmia that often causes palpitations. This suggests that managing blood pressure effectively can help prevent irregular heart rhythms. It's important to note that while palpitations can be associated with high blood pressure, they can also result from other factors such as stress, caffeine intake, or underlying heart conditions. If you're experiencing frequent or severe palpitations, it's advisable to consult a healthcare professional for a thorough evaluation. Next, number 10. Tinnitus. Hearing a persistent ringing or buzzing in your ears? This sensation, known as tinnitus, can sometimes be linked to high blood pressure. When blood pressure is elevated, it can strain the delicate blood vessels in your inner ear. This strain may disrupt normal blood flow, leading to the perception of noise or ringing sounds. Interestingly, a study published in the Frontiers in Neurology in 2022 found that individuals with hypertension had higher rates of tinnitus compared to those with normal blood pressure. The researchers suggested that managing blood pressure could be a key factor in reducing tinnitus symptoms. It's also worth noting that certain medications prescribed for high blood pressure might contribute to tinnitus. For instance, some diuretics and aspirin, commonly used to manage hypertension, have been associated with ringing in the ears. If you've noticed tinnitus after starting a new medication, it's important to discuss this with your healthcare provider. Managing stress is another crucial aspect, as stress can elevate blood pressure and, in turn, exacerbate tinnitus. Incorporating relaxation techniques, such as deep breathing exercises or meditation, into your daily routine may help alleviate both high blood pressure and tinnitus symptoms. Remember, if you're experiencing persistent tinnitus, it's essential to consult with a healthcare professional. They can help determine the underlying cause and recommend appropriate treatment options tailored to your needs. Next, number 11. Tremors or muscle tremblings. It's intriguing to consider how our body's internal signals can manifest as physical symptoms. One such example is the relationship between elevated blood pressure and muscle tremors. When blood pressure rises, it can trigger an overactive response in the sympathetic nervous system, the part responsible for our fight or flight reactions. This heightened activity can lead to the release of stress hormones like adrenaline, which in turn may cause muscles to contract involuntarily, resulting in tremors or shaking. A study published in the Journal of Hypertension in 2016 sheds light on this connection. Researchers observed 715 adults without prior hypertension and measured their hand tremors using a laser pointer technique. Over a median follow-up of 6.4 years, they found that participants with more pronounced tremors had a higher risk of developing hypertension. This suggests that noticeable hand tremors might be an early indicator of elevated blood pressure. It's essential to recognize that while tremors can be linked to high blood pressure, they might also stem from other factors, such as certain medications or neurological conditions. If you notice persistent or unexplained tremors, it's a good idea to consult a healthcare professional. They can help determine the underlying cause and guide you toward appropriate care. Next, number 12. Facial flushing. Imagine enjoying a drink with friends, and suddenly your face turns warm and red. This reaction, known as facial flushing, isn't just a cosmetic concern. It can signal how your body processes alcohol and its impact on blood pressure. When you consume alcohol, your body breaks it down into a substance called acetaldehyde. For many East Asians, a genetic variation slows the breakdown of acetaldehyde, leading to its buildup. This accumulation causes blood vessels in the face to widen, resulting in that familiar redness. But there's more to it. This same genetic trait has been linked to a higher risk of developing high blood pressure. A study published in the Journal of Clinical Hypertension in 2022 examined this connection. Researchers analyzed data from over 118,000 South Korean adults and found that individuals who began experiencing facial flushing after drinking had a 42% higher chance of developing hypertension compared to non-drinkers. This suggests that if you notice new flushing reactions, it might be a sign to monitor your blood pressure more closely. It's essential to pay attention to your body's signals. If you experience facial flushing when drinking, consider discussing it with a healthcare professional, as it could be an early indicator of how your body responds to alcohol and its potential effects on your blood pressure. Next, number 13. Numbness or weakness in the limbs. Elevated blood pressure can silently damage your arteries over time. This damage can lead to serious health issues, including numbness or weakness in your limbs. When blood pressure spikes suddenly, it can cause a hypertensive crisis. During such events, the excessive force of blood flow can damage blood vessels in the brain, leading to a stroke. A stroke occurs when the brain's blood supply is interrupted, causing brain cells to die. This damage often results in sudden numbness or weakness, especially on one side of the body, affecting the face, arm, or leg. The American Heart Association emphasizes that if you experience these symptoms, it's crucial to seek emergency medical attention immediately. In some cases, severe hypertension can lead to a condition called intracranial hypertension, where increased pressure within the skull affects brain function. This elevated pressure can compress nerve pathways, leading to symptoms like weakness and loss of reflexes. A study published in the Journal of Neurology, Neurosurgery, and Psychiatry discussed cases where patients with intracranial hypertension experienced such neurological deficits. The study suggests that the increased pressure may cause nerve root compression, leading to these symptoms. It's important to note that while high blood pressure can contribute to these symptoms, other conditions can also cause numbness or weakness in the limbs. Therefore, regular monitoring and management of your blood pressure are essential to reduce the risk of such complications. That's it for today's video. I hope you found these warning signs of high blood pressure helpful and eye-opening. Remember, early detection can truly save lives. If this video really helped you, type "helpful" in the comments below. Your support motivates us to create more life-saving content like this. And if you haven't already, hit that like button, subscribe, and turn on notifications so you never miss our future videos. Thank you for watching, stay healthy, stay aware, and we'll see you in the next video.